What's up, listeners? This is the fourth episode in our Health Highlights series recorded live at the Health Conference in Las Vegas. We asked leaders how they're seeing the consumer point of view being incorporated to bridge the gap between traditional sick care and consumer-based well care. Today's episode focuses on consumer experience, particularly engagement in between healthcare episodes. So you'll hear from Anika Gardenhire, Chief Digital and Transformation Officer at Ardent Health, Michael Dalton, CEO and founder of Ovatient, and Vindell Washington, Chief Clinical Officer at Verily Life Sciences. Let's get into it.
I'm Anika Gardenhire, Chief Digital and Transformation Officer at Ardent Health. Thank you for having me.
You want to share just some of the more recent accomplishments and things that we can celebrate?
Sure. I'm always excited about what we're doing at Ardent. One of the things we recently announced is an all-in partnership with Ambience, and super excited to provide that tool across our provider base and to continue to see the great things that Ambient Solutions are going to do for provider burnout and retention.
Kind of what's the goal of that? What do you hope happens as a result of that partnership, and kind of where is it focusing?
So we're starting with ensuring that we can support provider recruitment, provider burnout, provider retention. I think, like most organizations, we're really hopeful that that will help keep providers in the workforce longer, that we will see better experiences for patients, right, as providers are untethered from their devices, and less pajama time, better quality of life. And then I hope that there is a natural opportunity around increased access because more patients can get in, because we're taking unnecessary task burden off of our providers. And at the end of the day, I'm a registered nurse, and I hope that we don't leave the other clinicians out of this sort of ambient solutioning wave. And so I hope that we continue to see more in those broader spaces.
When I think about the broader conversation that, at least like we've been having on this show, right, of yes, we've been improving, we as an industry have been focusing on improving the patient experience for a lot of years now. And it's great work. And one of the pieces or kind of corollary aspects of that conversation has been, what about when you're not a patient? Yeah,
Yes.
At least what about when you're not being actively cared for?
Yes.
Whether we call it a consumer experience or not, how can we help people better understand how a care team helps them in areas of their journey that they might not think so normally?
Yeah, so I really think that we're sort of in a reckoning from a consumer experience perspective. And I think about that from the perspective of both convenience and ease of use and the ability to navigate. And so exactly as you said, first and foremost, it's just which portions of this care journey am I supposed to navigate alone versus with others? And how do we use solutions to sort of help me figure that out? And so if I happen to be one of those consumers that likes my wearables and sensors, and I'm tracking and I'm sort of in the data, right? How much of that can be trusted by me? How much of it can be trusted by my provider? If I'm actually not one of those consumers, I'm not, walking around with, sensors and wearables, then what other information might there be about me out there? And how do we think about the entire sort of gamut of technology that we have to bring to bear, whether that's remote patient monitoring or whether that's, more frequent visits or whether there's new solutions around DEX scans and like all of the other things that are coming out in order to help us better have information. I think that there is this new opportunity around gathering that information, like sort of codifying that information and then presenting it in a way that is consumable and actionable. So if you actually think about what's happening right now, not only from sort of a documentation perspective, but more broadly from an ambient listening perspective, that's actually what's happening in that process. And so there's a lot of conversation about, will we end up in a place where healthcare is more GUI-less? Will we end up in a place where these tools are more accessible to our patients? Will we end up in a place where, quite frankly, we're able to share information in a completely different way, and the only thing we actually see is the decision support? I'm here for all of it, to tell you the truth. Like, I'm super excited to sort of see where it is. I can't necessarily say that I'm putting my finger in the wind and saying we will end up there. I think the position that we're taking at Ardent is we want to be great partners. We want to make sure that we're supporting our clinicians as they attempt to adopt these new solutions. We want to make sure that everything that we're bringing into the organization is actually effective and is delivering on the outcomes that they say that they're delivering on. And then we want to make sure that we're putting our patients in the feedback loop and that we're actually asking our patients about their experience and what's happening, and that we're doing experience research, and that experience research is actually feeding into our strategy. So that's what we're focused on, and hopefully that's going to lead us to the right choices.
You're acknowledging that this isn't just like a single effort from one entity or one side, or that a consumer can necessarily figure this all out by themselves. The health system plays a role. There are some great tools and other areas that could play a role. If you just leave that all up to the person who's seeking care, not only overwhelming, it's also so hard to navigate, and it's so hard to feel good that you can trust whatever that ecosystem looks like that you could put together. So I've always thought, the more that a health system can understand what role they play in that, the better place they're going to be. Does that feel like kind of where you're coming from?
Absolutely. I mean, I think trust is at the crux of all of this, right? We need to make sure that consumers have trusted sources of information. We need to make sure that the clinicians who are caring for them have the same. We need to make sure that we're providing experiences and feedback loops that agree with the individual, right? And so the easiest way, I think, to lose trust is to have discordance between what you say and how I feel. Right? Yeah. And so I think many of us have been in that situation where you're having a conversation with someone, and that person might be a part of your provider team or other, and you're talking about how you feel, and there seems to be this discordance between that and the actions, or the understanding, or the logic is not making sense about what the actual actions are. And I think the great thing about what's happening is that we will have an even more informed consumer in healthcare than we've ever had before. We have to make sure that we are not only contending with and sort of tolerating that, but we are welcoming that, and we're using that in the actions that we're taking, because this is a team sport, right? We've got to be in it together. And so it means that our patient / consumer / customer / whomever the relationship is to you is in it with us. And as providers, as partners in the healing journey, as clinicians, that we're going to have to figure out how to captain a team, and to have this be a team and be coordinated as we look forward.
Well put. It really is a team sport here. I was going to ask, how do we get there? That's the most loaded question I've ever heard. So, the thought of where can we get to in the foreseeable future along that path?
Yeah, so I actually think it's not that far off. A lot of what, if we actually look at the disciplines and how they were designed, in some instances before we sort of loaded burden onto them, if you go back to sort of, the provider lens being very curative and focusedly curative. If you go back to the nursing, oftentimes clinician lens being environment of care focus and coordination of care focus and advocacy focus. If we actually can go back to sometimes the purity of disciplines, if we'll recall, before some of the sort of additional burden was placed on them, they actually came together quite nicely. And there was actually a really great place for partners in healing. There was a really great place for the patients themselves. And so when you actually go back to the purity of the care team, it actually did work. And so I think in some ways we actually have an opportunity to sort of rewind and play back the tape in the way that it was originally intended. And I think we actually get closer than trying to create something net new.
Okay, I love this for several reasons, but one of them is because it's not based on or a result of, hey, we have new tech now. We have better tech that's going to do that for us, which, yes, that's part of the equation, but it's like cart before the horse kind of a thing. And I've long thought that conversation only gets us so far of like, cool, look at what you can do now with AI, versus let's look at the purity of the disciplines. What else haven't we discussed here that's just worth sharing with our listeners, knowing that many of them are working in health systems? They're trying to understand. They're nodding in agreement as you've shared this vision. How do you help them understand what to do in the immediate future and how to help create a vision in their own organizations?
Yeah, so, I actually think that having the opportunity to look at the intentionality of the design is really important. It's exactly like I was speaking about earlier. When I think about whether or not the design was designed well, but, maybe we stubbed our toe on the execution, or the design actually wasn't quite right. The execution went really well, and so actually we got exactly what we were designed to get, except that's not actually what we wanted to get, right? And so I think spending time trying to understand where we actually are, or where your organization actually is, and then which portion of it you actually need to change. Is it we actually need to go back to the drawing board on the design? Is it actually we need to go back to the drawing board on the execution? Is it maybe we didn't actually have the right target in the first place? We ended up exactly where we intended, but the target was off, so that you can spend your energy and time in the right place, powered by these new solutions, right? It's how I hope that we're all going to be thinking about this.
Anika, really appreciate your time here. You're painting a picture for us and you're giving us a vision of what's not only possible, but it's being worked on right now. And I appreciate that.
Thank you.
All right, Michael, what's the latest with Ovatient?
Latest with Ovatient. So we are fully launched at MUSC. So we have our virtual patient center medical home. We had probably our best month ever in September in terms of volumes. We started to see that kind of school rush as people are coming in, getting care after Labor Day, establishing their relationship with Ovatient from a virtual primary care perspective, but also starting to see an uptick in our urgent care video visits at MUSC. So that was a big launch to be able to provide visits across the entire state for South Carolina, and starting to then build out and build traction for virtual primary care as an option. They have really it's demonstrated that it's a primary care shortage area. They're trying to add almost 100 new primary care providers across the state, and Ovatient is part of that solution, bringing 10 providers to bear there. One of the things that we also have been working on and focused on is how do we help our health systems, who right now they are facing a lot of changes in coverage to their patient population. So a number of patients are losing coverage. So that could be Medicaid. They're looking at with the health insurance exchanges that potentially that they're going to be losing subsidies. And so one of the things that we've really stressed and helped both Metro Health and Medical University of South Carolina is understand how patients can access high quality care from Ovatient, but with a cash option. So that's not something a lot of health systems think about, being able to provide that, that ability for a cash option for care. But that's one of the things that we really focused on, is democratizing direct-to-consumer care. What that means is that, hey, from a health system's perspective, or for a patient, oftentimes direct-to-consumer care, they have to subscribe. They're having to pay out of pocket. They're having to pay more. The health system is already subscribed to Ovatient services, and then we're able to pass that along. If they have a payer relationship and they have a payer plan and they're covered, great. We're going to bill your insurance. If you have a cash option and that's what you need, then we're able to provide an affordable option for the patient to be able to still stay connected during this time of kind of flux.
What other aspects of the experience are you focusing on at Ovatient? And I guess what are you seeing that leads you to say, like, here's something else that we need to address in a similar way?
What we were talking about is this notion of being able to build and maintain trust. And so that's a credible component. So my kind of action orientation is no wrong door, no dead ends. That's how the patient needed to be able to, and so we have to think through that patient journey and where that patient's gonna, where they're gonna start. So we spend an enormous amount of time in our provider directories. Both of our customers right now are doing, at the same time, website upgrades, massive rollouts. So we're working through and understanding what's changed, what's the patient journey going to look like, providing feedback to them. We had that on the front end, but now we're trying to see, and we're looking for, is there any drop off? How are patients engaging? MUSC just went live with DexCare. We need to see then, okay, where do Ovatient providers, or how do we feature Ovatient in a service offering within DexCare from a provider directory perspective, so that patients understand the value of Ovatient or virtual primary care? How is that being featured? There's a lot of politics that go into that. The provider directory it's very political. So, you have thousands of providers, and how am I being featured? How am I being, talked about? How are my services, comparing? And so that's the one thing that we've spent a lot of time in understanding is when that patient's coming in and they have that expectation, how do we meet them? How are we talking about care, whether it's primary care, urgent care, behavioral health? We need to be helping our health systems be the easiest health system to access at this point. So that's we've been spending a lot of time. It's not sexy, but it's necessary to be able to maintain and build that trust. And we sit at the integration between the marketing team and the digital experience, as well as then the informatics and the IS teams. And they sometimes don't speak the same language, and we're kind of like I think I maybe said this to you guys, like Epic is our love language. And so we need to be understanding of like what's happening in that Epic space, but then we're translating that from a marketing perspective and understanding those capabilities and how they're going to interplay. So we were at UGM as well earlier earlier this year. And what I was excited to see is Epic is starting to roll out some marketing capabilities and analytics capabilities that are going to better help our marketing teams at Ovatient and at our health system customers be able to track what that patient journey is, where is their fall off, how are we performing. That is going to build trust with the health system and the patient as well.
Right, and within the context of where their existing investments are, which is, I've already said from the beginning, building it within the Epic ecosystem lends you a wealth of advantages in terms of the trust within the IT team, the marketing team, and so forth.
Absolutely. An access team. That's one thing that was a capability. Again, not super sexy, but we used Epic's Book Anywhere capabilities. Patient calls in. We want to provide those agents. That builds trust with the agents in the access center. If they have a patient who needs to be able to be seen, they're able to not tell a patient, hey, go to Ovation or go to our MyChart. They can drop that patient onto a template through the Book Anywhere functionality because they can see in Epic, their own instance of Epic, they can see our templates and schedule that patient in to see an Ovation provider. So that's even a no wrong door for that patient coming into an access center or for that agent as well.
We're taking steps towards a more consumer-centered healthcare experience. Like, that's the whole goal here. So as we think about that, what else is on your radar screen personally that maybe is related to that, or maybe it's not, but the things that you're spending your time focusing on and kind of trying to keep up on?
I just saw the Peterson Institute's report that came out, and I shared that with my team about from a digital health perspective. Health systems are still continuing to make investments. Employers are pulling back a little bit, but where I see an opportunity and I'm trying to help from our customers is how are they featuring their services for employers. So that is what I'm excited about. I've spent a lot of time from maybe it's not personal, but I'm professionally very interested in how do we help our health system customers stay connected to employers and employer networks and not be not having that disintermediation between that relationship between a patient. Because oftentimes you'd see these like third-party solutions, but they're like, I'm still getting my care in the community, and it's not connected. So we launched My Care Anywhere earlier this year, built on League's digital consumer experience platform. The target market is to be able to take this product featuring our health systems and their services to employers. So I'm spending a lot of time on that. And as I think about it, we're hearing more interest around like weight management solutions or what are we doing to support women's health, menopause, perimenopause. That's all part of the primary care journey. We should be able to do that really well for that patient. Half of our patients are, when they're coming in for primary care, we're supporting them with their weight loss journey. So this is not something you need to be able to go and do outside of Ovatient or outside of the health system. We are offering and formalizing that and keeping that patient connected through Ovatient. So that's the whole thing. Like, you don't need to subscribe to Noon, or maybe it's Hims, Hers, wonderful companies providing outstanding services, but they're outside of the health system, and you're able to provide that same level of service and care through Ovatient and the health system customer.
Michael, we really look forward to keeping in touch and following Ovatient on their journey. Thanks for taking the time here and sharing a lot of what you're seeing and hearing in the industry, and we look forward to keeping up with you.
Thank you, Jared.
Yeah, my name is Vindell Washington. I'm the Chief Clinical Officer at Verily Life Sciences. Super happy to be fully on the health tech side right now.
Yeah, it's a good time.
It is.
Speaking of, what's the latest news from Verily, and what would you like to share with our listeners?
Well, I'm super happy about a couple of launches that we have in this window. So the first I'll bring up is Verily Me, which is our digital solution that provides health guidance to individuals. It's available today in its beta release. You can sort of pick it up on either your app store of choice, and really helps give people some guidance along this complicated healthcare journey. It's powered by this solution called Pre, which is also what we're launching. It's the platform or the individual information system that sits beneath all the solutions that we bring to market. And we're also announcing a study, lifelong registry, a disease registry study that we are happy to sponsor as part of some of the work we do.
Maybe I can take these a couple, or like one at a time. On Verily Me, what do you hope is the outcome for the user, for the consumer who's using that?
Yeah, there's a little bit of a story behind it. We have been in the direct care business for almost 10 years now. So we've been doing population health work, started with diabetes, moved to a more whole person-centered approach. And the one thing that all of our clients were pushing us on, number one is, are people engaged in using this solution, heavily engaged in the solution use? And then number two is, really, are we making the right thing, the easy thing for the individual person? And do we as a health team have the right information to treat people well? So what Verily Me really was born out of is this sort of need to grab more information and to have this more engaging user experience. And what we've decided as a company that it's not just a user experience we put in front of our care delivery products like LightPath, but it's also the solution we put on all of our products, our research products and registries as well. So the ability to reach people where they are, give them some individual guidance about their health and how to stay healthy based on really what recommended next steps in health they would do, and then engage them in a delightful experience where they're able to look at the recommendations themselves, query their medical records, look at the records that have been produced on their behalf, and do fun things like log their meals and have sort of more of a consumer experience on that sort of side of the house with the meal logging, while we're actually teeing them up for more intense services.
Well, one thing that's interesting about that is how it's been tried from the sole consumer standpoint, right, as opposed to any involvement really from the clinical team, and let alone someone who has enough data to help kind of steer some of those decisions.
I think you're getting to the critical points. So if you're just asking people about how to stay healthy in a vacuum, I think you get pretty generic recommendations and information. So if I'm literally just telling you to eat well and exercise, you don't really need an app to tell you to eat well and exercise. On the other hand, if you're really giving people information and recommendations based on what they know about you, if they agree to enter into that caregiver relationship, then you're able to have a more enriched experience with that individual. So we're making the bet that enriched experience and really giving concrete and personable information and directions to individuals from the perspective of a licensed provider, that's a better overall experience. And no less empowering for the individual. Like, we want the individual to be empowered, but with the support of licensed and knowledgeable professionals that we put at their disposal.
Yeah, and I see why that's a big step forward, because to my knowledge, to this point, it's primarily been one or the other. Hey, good luck, consumer. Yeah, here's an app, here's some data, you're tracking yourself. Good luck with that.
Yes.
Good luck figuring out an ecosystem around that.
Absolutely.
Or fully from the clinical side, on the other side of the spectrum here, of not having enough of that personalized data to do anything with.
Well, and I'll just add to your last comment about that. Often, particularly for population health, it's done from the perspective of the provider. I'm in a risk-based arrangement with my payer. I'm trying to do Medicare Advantage. So there's some things I need you to do to make sure my income stream is protected. And I'm not saying that all those are that transactional, but I do think if you're in those kind of financial arrangements, you have an order of march that traditionally people have followed that have not necessarily been around that individual and their experience.
For sure. Yeah, you're talking about truly personalized experiences that I'm laughing because of the attempts that have been made and referred to that in other areas where like the parts that actually mattered weren't personalized.
Absolutely. And the other thing is, I mean, I get it because I was in the health system for a while. The profit margins are very slim.
Sure.
So what people are trying to do is maximize the high cost resources that they're having. But sometimes that literally comes at the expense of the experience of the individual. And so there have been fixes tried for that, like a concierge medicine strategy, where if you have enough money in your pocket, you can pay for the kind of attention that you'd like to have. Yep. But it's really not in the best interest of the entire health ecosystem to have just a tiny slice of people with this concierge experience and everyone else is just struggling through what exists in the healthcare ecosystem.
Very much on the same page in terms of, like what we hope to see from this point on. On our show, we focus on spotlighting the consumer point of view because it's our belief absolutely that the more we do that, the better experiences will be designed and we'll accelerate our progress. I
do think it's also a nuanced experience that you're aiming for the individual. So I tell my wife and I talk about the financial framework all the time, which is to say, like, I want someone to help me as we're trying to manage our personal finances, but I'm not all that interested in knowing what a real estate investment trust does and if I should have, so part of it is, I think in the ultimate health experience, you have this trust with an individual or a system of individuals that are going to help you live your best life. You want to have some agency, how risky, how low risk, where do I want to be on the care spectrum? But it's a partnership that you're aiming for. And from my perspective, some of the early efforts on empowering patients have been just what you said before. Have at it. Here's some data. Have at it. Here's the internet. Do some research. We're really convinced that it's this combination of the tech and the infrastructure, plus the licensed knowledge providers that are developing trust with you that help you live your best life.
I like the vision that you're presenting here
Yeah.
in terms of where this can go, and a lot more rapidly than I think we're giving credit for to this point. So,
Absolutely.
what about you personally? What's kind of in the middle of your radar screen right now? What trends are you paying attention to?
Well, I mean, for almost a decade now, I've been sort of concentrating on this idea of information flow from a data perspective. So, like, number one is before we do all these fancy things, information has to move. So when I was national coordinator, we worked a lot on information blocking. I was there when we passed 21st Century Cures. I've been watching the legislation turn into regulation. And I think like some of that work is coming to fruition. So I really have my eyes set on that, because some of the stuff in the middle of the showroom around artificial intelligence and all that stuff depends on an information structure and the flow of information. So it's hard to do that with little tidbits or not enough information. And then the second thing I've been really sort of concentrating on and thinking on is, once you have the information there and have it in place, do we have the right ideas of what safe and effective deployment of new technologies is going to look like? So have people thought deeply enough about where they want this large language model to function? What's the Goldilocks level of regulation? So not enough to choke the work that's being done, but not one that just exposes individuals at their most vulnerable time in their lives to whatever the latest sort of tech rollout needs to happen. So I think it's this weird time where you want to accelerate, but you want to have the right balance. So I've been watching those really closely.
Anything else we haven't mentioned that you'd want to share with our listeners?
Well, the one thing I would say, and this is sort of maybe a tag on to the issue around the data itself. There's so many more important data types, particularly in population health. So one of the things we're thinking about with our introduction of sort of infrastructure that all of this is built upon is the future is not just going to be what did my physician order for a lab test to be drawn. Was I active today? Was my mental state in a good place? What did I eat today? And those things are only done at scale through technology strategies, and they're only useful if they're put into a data ecosystem that allows you to look at maybe your steps data and the beta blocker you were prescribed for your high blood pressure, and whether or not any of that is sort of working in the stressful environment that you're working or living in as a person. So I think from a company's perspective, this free flow of data and having data that's usable and actionable and available to both care providers and the actual patients is the thing that we're most excited about.
Fantastic.
Yeah.
Vindell, thanks so much for joining us today, and I appreciate your time.
Yeah, thank you. Appreciate it.